Pediatric ear and throat problems have always been a very prominent part of our practice. Surgery isn't always the only answer to treating ear and throat problems in children. There are many things that we treat medically. Many things are temporary in nature, and so we treat them medically for a period of time, hoping that they'll get better. And over a period of time, sometimes it becomes evident that they do need surgery to correct their problem. The most common ear problem that we face is recurring ear infections, which results in both temporary hearing loss as well as the problem of having the recurring ear infections. The treatment for that problem has been around for many, many years and has changed very little. Placing ear tubes in a patient's eardrum in order to relieve fluid which accumulates in the middle ear has been a solution to recurring ear infections which has been around for years and years and years. The basic principles associated with treating that problem are the same as they ever have been. There have been some advancements in the types of tubes that we put in, the material that they're made out of, in order to make them safer for the patients. The tubes are temporary. In general, they last about 1 year, and most of the time they come out on their own. The vast majority of children, after that first set of tubes comes out after 1 year, are all better from their underlying problem, and they go on to have normal ears. There's a small percentage of children who will need another set of ear tubes, occasionally another procedure to help the function of their eustachian tube, such as taking out the adenoids, but the vast majority are better after that first set of tubes. Now, in treating pediatric tonsil problems, which is also a very long-standing problem and which has been treated for years and years with tonsillectomy and with surgery interventions. The most common advancement that has taken place over the years is development of new technology to take out the tonsils to reduce the pain associated with that procedure. But before I was practicing medicine, the techniques that were used to take out the tonsils either resulted in a higher complication rate, specifically bleeding after tonsillectomy, or more pain. And so nowadays we've tried to make a compromise between being able to cauterize the blood vessels so that they don't bleed and minimizing the postoperative pain. And so that's done with new technologies such as coblation and other similar technologies which allow us to cauterize blood vessels but minimize the accessory damage to other tissues which is created by burning and heat. The same technology that we use to take out the tonsils is what we use to take out the adenoids as well. The adenoids reside in an area of the body that doesn't cause quite as much pain when you take them out, but the risk of bleeding is still there, not as great as with the tonsils, but the same technology applies to both places. There are two principal reasons why we take out the tonsils and adenoids these days. One of them is for recurring infection, and the other is for sleep disturbance or sleep obstructed breathing. For the infectious problem, the cure rate is greater than 95%. We'll be all better from recurring sore throats and tonsillar infections, throat infections, after taking the tonsils. The same thing applies to removing the tonsils for sleep obstructive breathing problems. The cure rate is very high, very good success, and the results are immediate. Many children have snoring as a result of their obstructed breathing, and most parents report that the day after surgery they notice that there is no more snoring. The most frightening thing for many families is the actual act of the surgery, when there's separation from the mother and the children. And I think the best thing that we have to offer to comfort families in that situation is the staff that we have, that we employ to help take care of these patients. And I think one of the things that makes us all natural at that, at Topeka Ear, Nose, and Throat, is that we're first all fathers. And so we all have children of our own. And so we have a very keen interest in addressing these children and relating to them and in connecting with them right off the bat. If a patient is scheduled to undergo a tonsillectomy and adenoidectomy, they can expect for the patient to be in the operating room about 20 minutes. And then there's some postoperative recovery time when they'll still be separated from their child, but the total time is 20 to 30 minutes. actual operating time is more like 10 to 15 minutes, and so it's a very quick procedure these days. The anxiety that is created by waiting for that to happen may make it seem like much longer time, but in reality it's a very brief and very quick procedure.